The way you sleep every night might be slowly damaging your body. Your neck pain, your back pain, even your wrinkles could all come from one simple thing: your sleeping position. Some positions help your spine, improve breathing, and even slow aging. Others can quietly ruin your posture and cause chronic pain. Let's break down the most common sleeping positions and what they actually do to your body. Sleeping on your back is often considered the healthiest position for your spine. When you lie flat with your head, neck, and back aligned, your body stays in a neutral position. That means less pressure on joints, muscles, and discs in your spine. If you often wake up with random back pain, your sleep posture might be the reason. Back sleeping can help fix that. There's another surprising benefit. When you sleep on your back, your face isn't pressed into a pillow for hours. That constant pressure is one of the causes of sleep wrinkles. Dermatologists often recommend back sleeping for this exact reason, but this position has one major downside: snoring. When you lie flat, gravity pulls your tongue and soft tissues backward, which can partially block your airway. For people who snore or suffer from sleep apnea, back sleeping can actually make breathing worse. So while this position is great for your spine and skin, it might not be ideal if breathing issues are involved. But if back sleeping isn't perfect, what about sleeping on your side? Side sleeping is actually the most common sleeping position in the world, and for many people, it's one of the healthiest. When you sleep on your side, your airway stays more open compared to lying on your back. That means less snoring and easier breathing. It's also one of the best positions for digestion. Sleeping on your left side in particular helps gravity move food through your digestive system more efficiently. That's why doctors often recommend left side sleeping for people with acid reflux or heartburn. But there's one mistake people often make. They curl up too tightly. When you pull your knees all the way toward your chest and tuck your chin down, your breathing becomes more shallow. Your diaphragm can't expand properly, and your body may not get enough oxygen during sleep. The solution is simple. Sleep on your side, but keep your body relaxed and slightly extended instead of tightly curled. This keeps your spine aligned and breathing unrestricted. But there's one position many people love, even though it's terrible for your body. Sleeping on your stomach might feel comfortable, but it's one of the worst positions for your body. The biggest problem is your neck. When you sleep on your stomach, your head has to turn to one side for hours. Your neck ends up twisted at an unnatural angle the entire night. Over time, this can lead to chronic neck pain, headaches, and even nerve irritation. Your lower back also suffers. When you lie face down, your spine loses its natural curve. The middle of your body sinks into the mattress, forcing your lower back into an uncomfortable arch. This constant pressure can lead to long-term back pain. Breathing can also become more difficult because your chest presses against the mattress. The only real advantage is that stomach sleeping may reduce snoring slightly, but overall, the downsides far outweigh the benefits. If you're a stomach sleeper, slowly training yourself to switch positions could make a big difference for your spine. But there's one sleeping position that can actually solve several problems at once. Sometimes the best sleeping position isn't flat at all. Elevated sleeping means raising your upper body at an angle, usually between 30 and 45 degrees. This can be done using a wedge pillow or an adjustable bed. For people with acid reflux, this position can be a game changer. When you lie completely flat, stomach acid can easily move into your esophagus. But when your upper body is elevated, gravity helps keep that acid where it belongs. This position can also improve breathing. Keeping your head and chest slightly raised helps prevent airway collapse, which may reduce snoring and mild sleep apnea symptoms. It can also help clear sinus congestion because fluids drain more easily when your head is elevated. The main downside is comfort. Sleeping at an angle can feel unusual at first, and some people may slide down during the night. But for the right conditions, elevated sleeping can significantly improve sleep quality. Your sleeping position affects far more than comfort. It impacts your spine, breathing, digestion, and even your skin. Back sleeping is best for spinal alignment. Side sleeping supports breathing and digestion. Stomach sleeping can strain your neck and back, and elevated sleeping can help with reflux and airway issues. Sometimes improving your sleep isn't about sleeping longer, it's about sleeping smarter.